Premature ejaculation, part 4, treatment, sex techniques. Before I go to explain those sex technique, I would like to clear some mistake and myths that is common between among the people with this problem. One of them is that they try to use any tools or technique that decrease their sensory stimulation, like they use multiple condoms or they use topical anesthetic medication like Xylo, spray, cream, and so on. That is the opposite of the goal of sex, because we want to feel it. Even though they maybe help a little, but that is not the way we treat the premature ejaculation, and usually are not uh, helpful and successful, because still the root of the cause still will be there, that we explain in previous clips. Another that unfortunately is very common, I heard, they try to distract themselves against, is against and opposite of the having sex, being at that moment, enjoying and pleasuring at the highest level with the focusing on the partner and sex, that has those benefit effect in our body and our mind. And this way it make it worse, if even maybe that help, but in the long term it will be harmful and doesn't have any good and benefit result. The worst thing is that many people they recommend, think that moment that you are close to the orgasm, think about some negative things. That is horrible. That is the at least those people that they use distract their thoughts about some good but not related to the sex. That's maybe a little help them, like the thinking about solving a math problem or thinking about their work job, all those stuff. But again, this is not the way premature ejaculation will be treated. Just we distract our mind from the sex. And again, what is the point of the sex? Being at that moment and enjoying and feeling every moment and everything during sex. So this will not be helpful too. And another, many people they try to masturbate many times before they want to have sex with their partner. The problem with this is one of the most important problem is become conditioning. I am not going to talk about the benefit and disadvantage and unhelpful side effect of masturbation in this clip, but later in another clip I will go talk about masturbation and all aspect of the masturbation. So that will not be helped too. And final, many people they try to use those alcohol or drug, especially narcotic and cocaine, and they try to use that or for helping their problem, even though they are at least at the beginning may be helpful, but they have two problems. First of all, in long term they get opposite way, and second, they got abused and they get addicted, and they have their own uh, side effect, and finally they can cause erectile dysfunction. So none of them are helpful, and we don't recommend for premature ejaculation. Now let's go for our topic for this clip. First, we have to, I would like to mention some principle about the sex therapy and those exercise. The point and the fundamental principle for sex exercise is that we bring our focusing on stimulation and excitement. In other words, this technique help us to be at that moment, at that situation, and feel everything that we are involved with that. That is our partner and sex. Opposite the other those thought and technique that I mentioned above, this in this technique we make opposite way. and we bring all 100% focus and our sense to the excitement and enjoyment. But little by little, with those technique that we are going to talk about, that we can control the level of the excitement and stop in a specific level as long as we want. Another is we increasing pleasure of the sex, because we are focusing exactly just only sex and pleasure that moment, every moment that we have activity with partner. And finally, the result of this will be a strong making a strong connection between us, that in long term is the most and fundamental result of this type of the treatment. Before that we start those technique, I have to mention we need some prerequisition and requirement for being successful this practice. First of all, we have to be honest and intimate with our partner. If we have any problem, any discussion, any unsolved argue and topics that we have between us, it's better first we fix those problem, because without those this technique will not be helpful. That is the point of the having sex with the partner. We are sharing our the most important our privacy part together. So in the for treatment of premature ejaculation, both the couples should be completely honest and intimate and naked, physically and emotionally. If there are some topics that they cannot share with each other, they can help from the psychotherapist, that they fixed and solve those hate and rage or angry, whatever it is there. We have to fix those at the same time that we are going to practice and treat premature ejaculation. Don't expect if you have some resentment and hate and this technique help you at all. We have to be an open book for each other. All our fancy, our problem, our anxiety, nervous, what we are worried about, every aspect of our sex experience, detail, feeling, wanting, all of them we have to share to each other openly without judge each other. Then with this practice, we will get to our goal. Second, these techniques take time, usually 1 to 3 months. Every week we have to practice once or two, at least once a week, or better 3 times a week. Those practice I am going to mention. So it take time, and unfortunately one of the common mindset among the premature ejaculation people is that they have a magic thing. They want everything easy, fast, and at highest level. That is the common in many culture and society, especially nowadays. Everybody want to become millionaire in one day, 1 year, or become the star in right away, just with some acting. That is a magic and easy, and some the best word is magic thought, that we don't want to spend time, energy, and our life to get a goal. We want to get shortcut and finish it. That is the reason many people they go and take medication and some stuff, that the only way they want easy and fast way. We don't have such things in reality in most of the time. Everything has a rules and principle. We have to follow that if we want to be successful in long term. Commitment is very important in this process. We have to stick on it. Just be patient. We will get there in a few months, sometimes sooner. And many times for the beginning, for affecting those other problems, especially self-esteem and other controlling for our excitement, Most of the time we need start with medication too. That those medication, especially we have a lot of medication, we talk about that later. They help a lot, at least at the beginning, but we shouldn't rely on the medication. Those just helping we get to the level of controlling our excitement. For after that, when we got to that point, we don't need to take medication anymore at all. But in some cases, maybe once a while, maybe we need it. Otherwise, we have to get to that point that we don't need any more medication. Now, let's go to our techniques. If we want to be successful for controlling our orgasm, the first step, beside of those cognitive therapy that we talk about, that the first step is meditation. There are a lot of meditation technique that among them seems mindfulness meditation is the best, has best result for many aspects of our life, including controlling our orgasm. I'm not going to talk about the technique for mindful meditation. I later I am planning to prepare a clip about how we use this technique, how we can do meditation, mindfulness meditation. See, up to that time, you can search in internet. There are a lot of good source from many academic places that you can use it and practice that meditation. Or there are in your area, I'm sure in some college and some institute, they have session for the mindfulness meditation. If you go few weeks and you get to that level, we need it. Usually when you get to that point for meditation and relaxing, it doesn't matter what situation and one condition and one position you are, even walking, sitting, lying, laying down, or uh, any other situation, you can get to the that relaxation mood with the meditation that you will learn. It is a technique. It's easy to learn it. Usually after 10 to 20 sessions, you can learn it how to do that. Now let's go for the our exercise. One of the important component of the orgasm and excitement, as I mentioned in the first clip, is contraction of the pelvic muscle. We have in the area we called it perineum, that is between the at the bottom of our pelvic, uh, from beneath of the root of the penis to the back of the anus. This area is the trapezoid area. This we called it perineum. There are a lot of the muscle during excitement, especially erection and close to the orgasm. Those muscles that involve start contracting stronger and stronger, and those contraction not only we can excited our sexual arousal. At the end, those contraction stimulate the centers of the orgasm. So the most important part for the beginning is we learn how we contract and relax those muscles. Those muscle for the detecting and feeling those muscle, we can put finger in front of our anus and press it. And contraction is like when you go to pee or empty those rest of the uh, urine in the bladder. You contract this muscle, all of this muscle, and you can feel it. If you put finger here and contract yourself, you can feel those contraction very easy. For this exercise, we have to have a good imagination and feeling about those muscle and contraction and relaxing. That is the point of this exercise. So at the beginning, you can touch with one or two finger at that region and contract yourself. This practice, we have to do it first at the beginning for 1 second. We contract 1 second and then relax ourselves. Then little by little, every day we increase it the time of the contraction. Later we can increase it to 2 second contraction and 2 second relaxing. Then later another day, little by little increase it to the 4 second contraction and 4 second relaxing. Each season we have to do it 10 to 20 times, and we repeat it 3 times a day, and we have to continue this activity and exercise for at least 3 to 4 weeks until we get completely aware and control of contraction and relaxing our perineal muscles. We have to remember that during this contraction and relaxing, try to not contract your buttock muscle or abdomen and tight muscle. Just contract these muscles. That the mindfulness meditation help a lot to this exercise. How we focus, concentrate, imagining exactly those muscle. You have to create an imaginary picture in your mind, those muscle, and with closing eyes and taking breath slowly deep in and breathe out. And during that moment, with that slow breathing and respiration, then we concentrate on those muscle and region, then we contract it for that period time, 1 to finally 10 seconds, and we repeat it until we get completely skillful to controlling those muscle without involving the other muscle or pelvic. The next practice is hip thrust or pelvic swinging. For that, the reason we have this practice, that we decrease the tension on those muscles that are involved during sexual activity, especially our belly and back and hip muscles. Those are very important, and thigh muscle. Usually in those people with the premature ejaculation, they have very tense muscle contraction on those muscle. They use it a lot. So with this practice, we learn how we do this thrust movement during intercourse with lowest tension in our muscle, especially on the pelvic and our back. We can do it in 3 positions: supine, laying down on our back, standing, and missionary position. The most important part in this practice is breathing slowly and deeply and abdominal or diaphragm respiration. What does mean? During inhale, instead of our chest expand, we expand and push up our belly out. That is, we call it diaphragm or abdominal breathing. With this inhale, our pelvic a little move back, and our lower part of the back move a little forward up. And with exhale, our it become opposite. Our belly goes down, our back become flat, and our pelvic a little move forward. This is the way we do slowly. Each of those movements should take 5 seconds. 5 second inhale and moving our pelvic and back, and exhale the same way. For standing, our tight and legs shouldn't be extended completely. So the best way is that we bend our knee a little between 20 to 30 degree. We can do it in front of the mirror on the wall, contact our knee to the mirror or wall, or use a chair that as a stable point. During this movement on standing, our knee is contacting with that obstacle and is stable, so we don't extend our knee completely during this movement. For this purpose, we do the same way as the supine. We breathe in. With breathing in, our pelvic move without with lowest tension and contraction. We move our pelvic forward, and with exhale, we move our pelvic backward. So we have to practice and get used to those movement with inhale and exhale, and movement our back with lowest tension in our muscles. Breathing out, move forward. Breathing in, move backward. On the missionary position, we can use a soft pillow or some soft balloon that is flexible and lets us, our pelvic, move forward and backward. And we can use a little help on the chest, that not too much force and tense our muscle on the elbow, but still we use it, our elbow, a little support for having enough room to move our pelvic during this activity. And we repeat it the same way with the breathing in and breathing out, and the same time movement our pelvic forward and backward with lowest contraction in our thigh and our back and our belly. We try to use only pelvic muscle a little, not the other muscle being tense. And finally is pelvic twisting, that like the dance, we twist counterclockwise and clockwise. All those practice better should done at least 6 times every time we do, and 3 times per day. But if we don't have time for the 3 times we do it, we can do it for 5 minutes every day. And it's better we do every day, at least once a day. For 5 times, we do all those combination in different position. 1 to 2 minutes supine, standing, and missionary position, or even we can practice in sitting on our knee. The combination of them, and you have to find out which position is better for your back and the minimum contraction on those muscle and minimum tension. One of the most important and effective technique that has been introduced by Master and Johnson is a sensate focus exercise, or usually is familiar and more familiar, they call it sex therapy. In this technique and exercise, we learn how to be in touch with our feeling, and that feeling is only including our touching and how we feel. And we empower with this technique, empower our touching feeling, those sensation of our touch, and empowering our imagination for focusing and attention in any spot our body. That is the basic and fundamental principle of this exercise that we call touch exercise, or more accurate, sensate focus exercise. With this technique, we not only we will in touch with our feeling, we learn what level of the arousal we are during sexual activity. And based on that awareness, we can play and control the level of our sexual arousal very easy after 1 or maximum 3 months. If we practice very well this exercise, we get control over our orgasm. There are some basic principles for this exercise that we have to remember and follow them. First of all, this exercise is not sexual stimulating. This is just for touching and feeling those moments and touch from each of our spot of our body or our partner, because this exercise can be done by a partner, a wife, or can be done as alone by ourselves, that we call solo. But the with partner is more effective and more successful, but still we can do it alone, especially in those people they don't have partner, or at least at the beginning they don't feel comfortable. They do this exercise with their partner. Still, we can do it alone and solo. Second, during this test, we have to remember that with those techniques that we learn from mindfulness meditation and breathing exercise into previous slide about the pelvic and how we breathe in and breathe out, abdominal breathing and relaxing muscle. During this practice, we have to continuously use this breathing technique. Slowly breathe in for 3 to 5 seconds and slowly breathe out in 3 to 5 seconds. That is the most important factor we have to remember during this exercise. Second, those relaxing our muscle, we have to use it a lot for changing our level of the excitement and arousal. The way we can relax, uh, we will learn that little by little how we lose contraction of each of those muscle in each spot of our body. With that touching and sensation, we little get used to and become skillful, expert to losing those muscle tension very easy. And another one is that we will not have intercourse at least for the first 4 or 5 sessions of the exercise. After that, we can have intercourse, but it's not doesn't mean that during this exercise we don't get orgasm. Most of the time, yes, we get it orgasm, but without intercourse. And beside of that, our goal and intention is not for pleasure. It's just for feeling those touching. That's it. Nothing else. And the other one, we have to remember the principle. We have to practice this exercise at least twice a week is better. 3 times a week is much better. Every other day will be great, but 2 times a week is the minimum we have to do this practice. And another one, for each practice, we have to start with non-genital area, touching non-genital area for 10 to 15 to 20 minutes. Then at the end of the session, we go and we exercise genital area touching exercise. How we do it is very important. Doesn't matter solo or with the partner. First of all, we have to create a time and peaceful environment that there is not any other external factor distract us, including our cell phone, and we make sure nobody can interrupt our session. Second, is the better we be completely naked, but you can have some dress if it's not comfortable, at least at the beginning. We can start with that, or the much better is in the situation that we are completely naked. And another one, after a while, we have to practice this exercise in different situation and condition. For example, in shower, in couch, in background or backyard, or any place that we feel comfortable, not uncomfortable. And another one is that during this exercise, if we are doing with the partner never ever try and intend to stimulate sexual the partner or ourselves. We are not going to think about the sex at all. We are just going to concentrate those touching that our partner or ourselves we use it. For touching, we can use our hand if we are solo, or another object that is more comfortable. We are more comfortable with that. For example, we can use a piece of the soft clothes like that velvet, or we use a feather, or hand is much better. Whatever is, can you feel it when you touch your body? That is the most important. For the if we have partner is better to start with the just touching with hand, but later we can practice this touching exercise with the lips or with other part of our body, but not genital area. With the foot, with the arm, with the hair, with the lips, with the nose, all of them except genital area. Those touching. So, when we want to start, first of all, if we do it with the partner, is better. We become receiver and our partner, wife, be giver, massage giver. And best position for starting is that both of them are naked or a little partial clothes, whatever, both of them are comfortable. And the men should be laid down on the abdomen and start from the back. This is the first session. And the best spot is, we should start, the partner or wife should start, is around the head or neck or from foot. And the most important part for this level is that our touching should be very gentle and light at the beginning. And the receiver, the man, should can feel it, the consistency of the wife hand, fingers, the shape of that, the texture of the finger, even if we can feel and imagine exactly in our brain which spot and create an imagination of picture of that spot in our brain without thinking about sex, just feeling and knowing exactly what those subject is touching you, how the film is touching you, how the warmness and the shape of that object that touching you. You have to create a connection and focus on there. During this exercise, you may be distracted and suddenly go to other thoughts, even think sex. You have to remind yourself, come back and again focus at that specific spot that our partner or ourselves by hand we are touching. This we can increase or decrease our pressure of our touching and feel those changes, how the shape of our body change, and create an imaginary picture in our brain. We start that one from the back, from top to bottom without genital area, or bottom to top for 5 to 10 minutes. Then we go to the front, make upside down. Then we start from that situation, the same practicing and touching. The most important for partners should do the same way. Nothing intentionally for creating a sexual arousal and stimulation, but without any doubt we start getting sexual arousal, we start getting erection. That is completely normal, but don't focus and concentrate that part of the exercise. Whenever you distract, try to come back, or your partner try to help you back to the touching. We shouldn't talk any word with each other. Just only we can use some words and sign that if the partner pressing too much, is the touching is too much or is discomfortable. The only thing that we can communicate with together. We shouldn't talk about any voice or noise. The only voice we can have it is that our breathing. That's it. Nothing else. We don't need to talk to each other unless we want to alert each other that stop or not, or wait, or pressure is too much, or you don't like that area. Many spot in people are sensitive or they become ticklish. At the beginning is normal. We can start go bypass that spot and do the other spot, and keep doing until after 10 minute back, 10-minute front. When we finish it, then we can end it to the genital area. But during this touching and feeling and concentrating in those spots, we have to always slowly breathe in and breathe out and create some muscle relaxation in our body. It looks like we don't have bone in our body. This is especially important when the level of sexual arousal increase a lot. In that case, we have to keep more come back and focus. Even partner can mention and point that you are going to that level. The partner can notice that your muscle become tense, your breathing become faster, your heartbeat go faster and pounding. All those they are the sign of that you are going to get the plateau level or close to the orgasm. With this, when we get to this one, we have to drop our sexual arousal one level lower. For ourselves, we can grading our sexual arousal level in different level. Whatever you are comfortable, you can make it mild, moderate, severe, and pre-ejaculation. You can do that or give it a number from 1 to 10 for each level. Little by little, you you will find out that what level of the excitement and sexual arouse you are. Based on that, the most important part is that we those 10 minutes from back or 10 minutes front, we have to increase and decrease. If increase our sexual arousal, for example, from mild, that is semi erection, to go to the moderate full erection, we have to, with the breathing and focusing, coming back to our touching point, that our partner or our self touching, focusing 100% at that area and losing our muscle contraction, the level of the arousal dropped one level lower, and keep it that one for 1 minute or 2 minutes, and then let it go. Continue that massage, or the partner stop the massaging, and then when we go one higher level of the excitement, then for after 1 or 2 minutes, we start with those relaxation, breathing, and focusing. We bring our sexual arousal level one step lower and keep it that one for 1 or 2 minutes. Then keep continue those touching and exercise until go a little higher, flat. At the level of the flat or plateau, your heart rate increased and you can feel it, and you don't want to stop touching. That person doesn't touch, means you are close to the plateau and pre-ejaculation. In those cases, right away with all this technique, again we have to try drop our arousal level a little one step lower, or if it cannot with those focusing and relaxing and breathing, if it doesn't come back down, we have to ask the partner stop touching and massage. Then when we finished for a few times, we do this going higher and lower level of arousal. We go for the After 2 or 3 times playing with this changing arousal to a level mild, moderate, severe, moderate, come to low, low again, go to moderate, moderate to severe, and so on. After a few times, then we go to the touching genital area. For touching genital area massage, not massage, touching, we have to prepare the same environment as a vagina. So if ourselves as a solo or partner wife use the lubricant gel and warm gel that create the same environment as a vagina, will be very helpful. We start with around the perineal, slowly, gently, and we as a receiver, we relax our muscle, especially pelvic and perineal muscle and all body, and keep doing uh, deep breathe in and breathe out, and focusing at the touching point that our partner or ourself is being touched, the feeling, the temperature, the consistency of the touching, the pressure of the touching. All those we have to focus and concentrate on those specific spot, not sex, just specific spot that has been touched. If it goes very suddenly goes very high, our arousal, and we want to keep continue, our partner or ourselves should stop touching. We start with that area, thigh, and then we go scrotum, and finally we go with the penis. During this part of the exercise, we are not thinking about the sex and pleasure, but it give a feeling good. That's fine. And so, sometime at the first session, maybe even we have orgasm and ejaculation. If it happen, let it happen. Don't prevent it. Don't stop it. If it happen. That's not big deal. We go still. We continue. If we get ejaculation or orgasm, our partner or ourselves, after cleaning ourselves, our partner or ourselves, we keep continue finishing our touching exercise for genital area the same manner, slowly, gently touching, a little pressure, moving around, but all of them should be gentle and slow, up to 5 to 10 minutes. The touching genital area will be continue based on whatever you are comfortable and your excitement spot. You have to be flexible, and your partner should find out, and you tell your partner that those spot will be last spot she will touch. Little by little, when you had a control of changing the level of arousal from different spot, you can apply those feeling and technique to your genital area, especially the shaft of the penis and glands of the penis. After your partner touching your body has finished, is now your turn that start being giver. Your partner lay down the same way that you did on the back, then front, each side 5 to 10 minutes, and finally, last 5 to 10 minutes, we finish it with the genital area. I forgot to mention that the most important when you are practicing that sensate focus exercise, both partner before starting should take a good shower and make themselves complete and smell good. That is very important and critical. And another one, that when we do this practice, at least in fourth to fifth times, the first 4 or 5 times, it's better we don't have intercourse after practice and technique. But if we need, we think one of our feel urge to have intercourse and sex, that's fine. Just after exercise, uh, pause for the 10 to 30 second, then we can at the end of the exercise, we can have intercourse. But during intercourse, just remember that use all those technique for relaxing, deep breathing, the pushing and thrusting pelvic the correct way, and all those stuff. And it's better for, at the beginning at least, the man be under and passive, and men or wife, women or wife or partner be at the top, and control become dominant, and man with premature ejaculation become submissive. That is that for the beginning, but little by little, when we get control and more control our sense, we can focus on those area, every spot that we touch. We can make it more sophisticated with oral, with link, with the tongue, with the breast, with everything our body. We can mix up our exercise, and in different position make it more sophisticated, doggy style, and all other position. Little by little we combined, and we experience in different situation that we can concentrate and focus at touching point. That is very important, that we advancing with exercise, we get to that skills to focusing, concentration, being awareness of our touching and our body and feeling. The another technique that sometime it will be used is a start and stop technique. As its name is obvious, during with this technique, the partner or person alone by himself stimulate and have stimulate or intercourse, and just before the time close get close to the climax, that we can feel and detect it with heart rate goes high, our skin color become red a little, sweating, muscle tense, heart rate goes high. At that moment, we have to stop stimulating and wait until the our arousal, sexual arousal level dropped a little down. Then we, after 10 to 20 seconds, we then continue and again stimulating or intercourse, and we repeat this one at three times to four times. And at the end, when we get it that feeling with those breathing and breathing out, breathing in, and relaxing muscle and focusing on contact point of intercourse, especially for that moment, with touching internal genital and even other spot of our body, we can control our level of exciting and arousal. Then finally let it go and have orgasm. This is one technique that sometimes it can be helpful. Another technique is a squeezing technique. In that technique, without anything, the after stimulating a penis or intercourse, before the person get to the point of no return point, means even do whatever you do, ejaculation will happen, and orgasm, you feel like orgasm. Before just that moment, we have to stop stimulating with the thumb and two finger, index and middle fingers, both ourselves or our partner. We press, squeezing consistent pressure, but not too much painful, just uncomfortable pressure for the person. We squeeze just below the glands, not the glands. We don't touch the glands. Below the glands, cornea here is the border between glands and the body of the penis. So we touch firmly and continuously for 10 to 20 seconds until that feeling at the level of plateau drop before ejaculation. That feeling drop, and even sometimes our erection, we lose our erection. Then we, after a few seconds, we wait and then stimulate again. It's better we wait 20 to 30 seconds, then stimulate again or have intercourse again. Then we repeat it every time and continue. We try to, if we want to be more successful, it's better we use this technique with combining to other technique, especially those take deep breath in and breathe out, relaxing our pelvic and hip muscles, and focusing on those touching area. Then we repeat it. We can do it 2 or 3 times, and at the 4 times we can let it go and have orgasm. There are some studies that show this squeezing, it will not be too much effective. It has some controversial result, especially if we don't do it correctly and touching that glands, or squeezing with all fingers, or finding the specific spot and moment that we are going to the no return point. It's very hard to get to that time. But if we use it that one with other technique and those exercise, it can help a little. And just again, is you have to practice and see which one help you most. But the most important are those uh, exercise and technique that we explained before this too. I would like to mention here another problem that some people with premature ejaculation they have, and that is, we called it point of penetration anxiety. Some people with premature ejaculation, they have this type of the premature ejaculation right after just entrance of the penis to the vagina. They feel and they experience orgasm. This is very specific situation. Some people have this problem. For this group of the people, first, starting with medication is very useful, especially for this group of the people. And then for the technique and exercise we use on these people is that we start with after stimulating and all those technique that we're talking for intercourse entrance the penis, we start with just pushing the glands to the vagina, not more. Just before entrance, we take a breath in and we relax our muscle, especially pelvic muscle, we and perineal muscle, those muscles that involve in the ejaculation. We relax them and we focusing exactly at the entrance. Then we take it out. After a few seconds, we take it out, and then after 5 to 10 seconds, again we entrance. But next time a little push inner, deeper, a little deeper. Then after, before we get it to that no return point, then we take it out again, and then we repeat this with deeper penetration and longer holding inside. And finally, after uh, 10 to 20 times, we finished, and then we practice. All this practice is better done at least 3 times a week until we get to that point that we will not have any more problem. We finish with this part. Next part will be medication, diet, and all other aspect of premature ejaculation treatment. Up to the next time. Have a wonderful time.